Welcome to another Pharmacy Pearl by PACU. Today, we're exploring the role of tranexamic acid in managing trauma. Trauma is the leading cause of death among people under 45, often due to uncontrolled bleeding. Tranexamic acid, an antifibrinolytic medication, effectively counters this by inhibiting the breakdown of blood clots. It's known for being easy to use, affordable, and having few side effects, making it a key player in trauma care. In the pharmacological management of trauma-induced hemorrhage, tranexamic acid stands out for its efficacy and straightforward administration protocol. Initially, a loading dose of 1 gram is administered over 10 minutes, preferably within 3 hours of the injury, with an option for a more concentrated 2-gram slow IV push, based on emerging data from pre-hospital and military contexts. This is followed by a maintenance dose of 1 gram over 8 hours as a continuous infusion, ensuring a sustained therapeutic effect. The administration of tranexamic acid is direct. The loading dose is given undiluted, with a maximum infusion rate of 100 milligrams per minute, a parameter that also applies to the subsequent continuous infusion, which, however, requires dilution with compatible IV solutions to maintain the advised rate. Pharmacokinetically, tranexamic acid exhibits a volume of distribution between 9 to 12 liters post-intravenous administration, indicating its extensive distribution throughout the body. Its protein binding is minimal, primarily to plasminogen at about 3%, facilitating its therapeutic action. The drug's elimination half-life is approximately 2 hours, with over 95% excreted unchanged in the urine, underscoring the need for renal consideration in dosing. However, the therapeutic benefits of tranexamic acid come with potential adverse effects, including hypersensitivity reactions, which necessitate vigilance for allergic responses. Ocular effects, seizures, and myoclonus point to its central nervous system implications, while thromboembolic events highlight a risk of clot propagation. Additionally, common complaints like abdominal pain, headache, and back pain may affect patient comfort and require symptomatic management. Let's discuss the pivotal studies exploring the impact of tranexamic acid in trauma and bleeding scenarios. In 2012, Morrison and colleagues had an observational study involving 896 participants compared a 1 gram TXA bolus, with additional doses as needed against a placebo. The outcome demonstrated a significant reduction in all-cause mortality, both within 48 hours and in hospital, underscoring TXA's potential to save lives in acute trauma settings. In 2013, Roberts and colleagues had an extensive randomized, placebo-controlled trial with 20,201 participants examine the effect of a 1 gram TXA bolus, followed by a 1 gram infusion over 8 hours. The study found a notable decrease in all-cause mortality at 28 days, especially when TXA was administered within 1 to 3 hours of injury, highlighting the critical importance of early treatment. In 2018, Sprigg and colleagues involving 2,325 participants, this randomized placebo-controlled trial evaluated a similar TXA regimen to Roberts' study. Results showed a reduction in early deaths and serious adverse events, although long-term functional status remained unaffected, suggesting TXA's benefits may be more immediate than enduring. Roberts and colleagues in 2019 conducted a study with 12,737 participants, also adopted a randomized, placebo-controlled design to assess a 1 gram TXA bolus plus an 8-hour infusion. The significant finding here was the reduction in death related to head injuries when TXA was given within 3 hours of the injury, emphasizing the time-sensitive nature of TXA's effectiveness. In 2020, Rowell and colleagues had a double-blinded, randomized trial of 966 individuals tested various TXA dosing strategies against placebos. The study concluded with no significant differences in 28-day mortality, neurological function, disability scores at 6 months, or progression of intracranial hemorrhage, suggesting that TXA's effectiveness might be context-dependent. Also, in 2020, Roberts and colleagues conducted a randomized, placebo-controlled trial with 12,009 participants, investigated a higher TXA regimen, which is 1 gram plus 3 grams infusion. The outcome showed no significant difference in deaths due to bleeding within 5 days, indicating that higher dosing may not enhance TXA's efficacy. In 2021, Bossers and colleagues conducted a prospective observational cohort study of 1,827 patients. Pre-hospital TXA administration was compared with no TXA in traumatic brain injury patients. The study found no link between TXA and reduced mortality at 30 days and reported an association with increased mortality in isolated TBI cases, suggesting TXA's role in TBI requires careful consideration. Also in 2021, Guyette and colleagues had a double-blind, randomized trial of 927 individuals explored the impact of various TXA dosing regimens in a pre-hospital setting. The study found no significant difference in 30-day mortality rates, nor in 24-hour or in-hospital mortality, challenging the benefit of pre-hospital TXA administration. Mahmoud and colleagues in 2021 conducted a randomized placebo-controlled trial involving 1,767 participants evaluated TXA's effect on intraparenchymal hemorrhage expansion. The findings indicated no significant efficacy of TXA in preventing IPH expansion, suggesting its benefits might not extend to all types of bleeding. Lastly, in 2023, Gruen and colleagues conducted a double-blind, placebo-controlled study of 1,310 participants, assessed TXA's efficacy in improving survival with a favorable functional outcome at 6 months, and found no significant differences, indicating that the long-term benefits of TXA may be limited. These studies collectively contribute to a nuanced understanding of TXA's role in trauma and hemorrhage management, pointing to its potential benefits in specific contexts, while also highlighting the need for careful consideration of its timing, dosage, and patient selection. Tranexamic acid has been extensively studied in various settings for trauma care, showing promising efficacy in certain contexts, but not in others. Despite the variability in dosing across studies, a common regimen has emerged, favored for its balance of efficacy and safety. TXA's minimal side effects, cost-effectiveness, and broad availability enhance its appeal in trauma management. However, its application must be judicious, considering the specific circumstances of each case, including the type of injury and the timing of administration. Ultimately, TXA represents a valuable yet nuanced tool in the arsenal against traumatic hemorrhage. For more details about these studies, click the link below. And for more concise pearls like this, visit our PACU website or follow our social media pages.